you over 60 or know someone who is? If so, listen up. There's a silent killer lurking around every corner, and the #1 cause of death among seniors might not be what you think. Heart disease claims 300,000 lives each year. That's 820 every day. But here's the alarming part. Many of these deaths could be prevented by avoiding just one deadly mistake. You're about to uncover the shocking truth revealed by a top heart surgeon. He warns that most people over 60 are unknowingly making this big mistake that weakens their hearts and puts them at risk of a sudden heart attack or stroke. Don't wait another minute to learn what this common mistake is. You could save your life. Welcome back, everyone. I'm here to help you through the wisdom of doctors. Today's video is no exception. The insights shared by renowned heart surgeon Dr. Sinatra will resonate with anyone concerned about heart health, especially those over 60. However, if you're not in this age group, rest assured that this knowledge could still save your life one day. So stay tuned till the end. Before we dive in, please take a moment to subscribe and click the bell icon to stay updated with our life-saving health insights. Now, let's get started. Mistake #1, ignoring early warning signs. Have you been experiencing unusual fatigue, shortness of breath, or chest discomfort? These seemingly minor symptoms could be early warning signs of heart disease. Ignoring them could be fatal. According to Dr. Sinatra, a leading cardiologist and world-renowned expert on cardiac longevity and functional medicine, most people don't pay attention to these initial red flags. They often brush off these symptoms as signs of aging or stress rather than potential indicators of serious heart trouble. Here's the harsh reality. Most heart attacks occur without any prior symptoms. However, there are some subtle clues that your body gives you early on, which, if recognized and addressed, can significantly reduce your risk of a heart attack or stroke. Common early warning signs include persistent fatigue, difficulty breathing, chest pain, irregular heartbeat, lightheadedness, nausea, cold sweats, and persistent cough. If you experience any of these symptoms regularly, don't hesitate to seek medical attention. It could save your life. Mistake #2. Neglecting regular checkups. Are you in the habit of skipping routine doctor visits? This bad habit could be putting your life at risk. The American Heart Association recommends that everyone over 60 should visit their healthcare provider at least once a year for preventive screenings and checkups. However, many people fail to prioritize these appointments, potentially allowing health issues to go unchecked and worsening over time. Regular checkups are crucial because they allow doctors to detect potential problems early when they are easier to treat. For example, high blood pressure, high cholesterol, and diabetes, which are major risk factors for heart disease, often have no noticeable symptoms, but these conditions can be effectively managed and even prevented with proper medical care. Skipping checkups increases your risk of developing serious complications, such as heart disease, stroke, or kidney disease. So schedule and attend your annual checkups without fail. Mistake #3, unhealthy eating habits. Are you guilty of enjoying fast food, sugary drinks, and processed snacks a little too often? If so, you're not alone. In today's fast-paced world, it's easy to fall into the trap of unhealthy eating habits. However, doing so can have serious consequences for your heart health. According to a study published in the Journal of the American Heart Association, unhealthy eating habits are responsible for nearly half of all deaths from heart disease. Consuming excessive amounts of saturated and trans fats, added sugars, and sodium can lead to high blood pressure, high cholesterol levels, and obesity, all significant risk factors for heart disease. To keep your heart healthy, focus on consuming whole, unprocessed foods like fruits, vegetables, lean proteins, and whole grains. Limit your intake of saturated and trans fats, added sugars, and sodium. Remember, small changes in your diet can make a big difference in protecting your heart. Mistake #4, lack of physical activity. Do you find yourself spending most of your day seated, whether at work, watching TV, or traveling? If so, you're not getting the recommended amount of physical activity for a healthy heart. The American Heart Association recommends that adults over 60 engage in at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week. However, many seniors don't meet these guidelines, leading to a higher risk of developing heart disease. Regular exercise helps maintain healthy blood pressure and cholesterol levels, improves overall cardiovascular health, and reduces stress. It also helps maintain a healthy weight, which is crucial for preventing heart disease. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Choose activities you enjoy to make it easier to stay consistent. Mistake number 5. Ignoring mental health. Did you know that your mental health is just as crucial as your physical health when it comes to heart health? According to research conducted at Harvard Medical School and published in the journal Psychosomatic Medicine, people who suffer from depression or anxiety are at an increased risk of developing cardiovascular disease. Neglecting mental health issues like depression and anxiety can have detrimental effects on your overall health, including your heart health. Chronic stress can lead to high blood pressure, which is a major risk factor for heart disease. Additionally, people with mental health issues may engage in unhealthy coping mechanisms, such as overeating, drinking alcohol, or smoking, which can further damage their heart health. It's essential to address mental health concerns and find healthy ways to manage stress, such as meditation, yoga, or spending time in nature. By taking care of your mental health, you're also safeguarding your heart. Mistake number 6. Inadequate sleep. Are you guilty of sacrificing sleep to get more work done or squeeze in more leisure time? If so, you're not alone. In our fast-paced society, it's easy to fall into the trap of sacrificing sleep. However, doing so can have serious consequences for your heart health. The American Heart Association recommends that adults over 60 aim for 7 to 8 hours of quality sleep each night. Adequate sleep is essential for maintaining healthy blood pressure levels, regulating hormones that control your sleep-wake cycle, improving your overall cardiovascular health, and reducing the risk of heart disease. On the other hand, chronic sleep deprivation can lead to high blood pressure, hormonal imbalances, increased inflammation, and insulin resistance, all of which elevate your risk of developing heart disease. Make sleep a priority and ensure you get enough restful sleep each night to keep your heart healthy. Mistake number 7. Smoking and secondhand smoke. Are you a smoker, or do you spend time with people who smoke? If so, you're putting your heart at risk. Smoking directly damages the blood vessels and raises blood pressure, leading to an increased risk of heart disease and stroke. Secondhand smoke also poses a risk, as the harmful chemicals in tobacco smoke can damage your blood vessels and increase your risk of developing heart disease. According to the American Lung Association, quitting smoking is one of the best things you can do for your overall health, including your heart health. If you're a smoker, seek help from your doctor or join a support group to quit. And if you don't smoke, avoid secondhand smoke by staying away from smoky areas and asking others to refrain from smoking around you. Making these simple changes can significantly reduce your risk of heart disease and help you breathe easier. Mistake number 8. Ignoring family history. Do you have a family history of heart disease? If so, you may be at an increased risk of developing heart disease yourself. According to the American Heart Association, having a family history of heart disease, stroke, or other cardiovascular conditions can significantly elevate your risk. However, many people overlook this crucial factor when assessing their risk of heart disease. Knowing your family history and being aware of your risk factors allows you to take proactive steps to protect your heart health. Talk to your healthcare provider about your family history and any concerns you may have. They can help you develop a personalized plan to reduce your risk and keep your heart healthy. Remember, knowledge is power when it comes to preventing heart disease. Mistake number 9, assuming heart disease only affects older adults. While it's true that the risk of heart disease increases with age, it's important to remember that heart disease can affect people of all ages. According to the Centers for Disease Control and Prevention, heart disease is the leading cause of death in the United States, accounting for approximately 697,000 deaths each year. Many of these deaths could be prevented by adopting a healthier lifestyle and managing risk factors such as high blood pressure, high cholesterol, and diabetes. Regardless of your age, it's crucial to prioritize your heart health and take steps to reduce your risk of developing heart disease. Mistake number 10, relying solely on medication. Are you taking medication to manage your high blood pressure or high cholesterol? If so, you're not alone. Millions of people rely on medication to manage their cardiovascular health. However, it's important to remember that medication is only one piece of the puzzle when it comes to preventing heart disease. While medication can help manage conditions like high blood pressure and high cholesterol, it's not a substitute for a healthy lifestyle. Continue taking your medication as prescribed by your doctor. Also, focus on making positive lifestyle changes, such as eating a balanced diet, exercising regularly, and managing stress. By taking a holistic approach to your health, you can reduce your risk of heart disease and improve your overall well-being. Mistake number 11, overlooking dental health. Did you know that your oral health is connected to your overall health, including your heart health? Poor oral health, such as gum disease, can lead to inflammation in the arteries, increasing the risk of heart disease and stroke. According to the American Academy of Periodontology, people with gum disease are twice as likely to have a heart attack or stroke. Gum disease also increases the risk of developing vascular dementia. Taking care of your teeth and gums is essential for maintaining good overall health. Brush your teeth twice a day, floss daily, and visit your dentist regularly for checkups and professional cleanings. By taking these steps, you can keep your smile healthy and reduce your risk of heart disease. Mistake number 12, assuming a heart-healthy diet is bland and unappetizing. When you think of a heart-healthy diet, does the image of bland, unappetizing food come to mind? Well, that's a misconception. A heart-healthy diet can be both delicious and satisfying. In fact, a study published in the journal Open Heart showed that people who followed a Mediterranean diet, rich in fruits, vegetables, whole grains, and healthy fats, had a lower risk of developing cardiovascular disease. Moreover, they also reported a better quality of life. Incorporating a variety of flavorful ingredients, such as herbs, spices, and citrus juices into your meals can make healthy eating both enjoyable and effective in reducing your risk of heart disease. Mistake number 13, infrequent blood pressure checks. Do you regularly monitor your blood pressure? If not, you might be putting your heart at risk. High blood pressure, also known as hypertension, is a major risk factor for heart disease and stroke. However, many people don't check their blood pressure frequently enough, allowing potential problems to go undetected. The American Heart Association recommends checking your blood pressure at least once a year, even if you don't have any symptoms. Several devices are available to help you monitor your blood pressure at home, such as upper arm monitors, wrist monitors, and finger monitors. Regular blood pressure checks allow you to detect any issues early and take necessary precautions to protect your heart health. Mistake number 14, ignoring balance issues. Do you sometimes feel off your balance or have trouble with hand-eye coordination? If so, it's not just an age-related issue. It could be a sign of something more serious. According to a study published in the journal Stroke, people who experience frequent dizziness or balance problems are at an increased risk of stroke and heart disease. These symptoms could indicate an underlying condition, such as atrial fibrillation, which can lead to stroke or heart failure. It's crucial to address balance issues promptly and consult your doctor to rule out any potential cardiovascular risks. Mistake number 15, not getting the COVID-19 vaccine. Are you up to date on your COVID-19 vaccinations? If not, you might be putting your heart at risk. Research suggests that people who are unvaccinated against COVID-19 have an increased risk of developing cardiovascular disease. According to a study published in the journal JAMA Network Open, unvaccinated individuals have a higher risk of developing heart disease, stroke, or experiencing cardiovascular death. The COVID-19 vaccines are proven to be safe and effective in reducing the risk of severe illness, hospitalization, and death associated with COVID-19 infection. Getting vaccinated not only protects you from the virus, but also reduces the strain on our healthcare system. So please take this crucial step to safeguard your heart health and well-being. If you enjoyed this video, please give it a thumbs up and share it with friends and family. Your support means everything to us. Stay healthy and take good care of your heart.